Hello, hello, good people. We are excited to be back here again. This is Gladys, your sister, and today I'm very, very, very happy. This is Gladys here today, joined by my brother, Dr. Gwewasang from Cameroon. And what I'm very excited about this is because I recently started a health tips channel whereby, after being in our business movement for a long time, on passive, even in our own families, the neighbors that we meet, I've seen that, healthcare is an issue that really needs to be discussed, and we can only support one another. And I'm so happy that Dr. Gwewasang Martin from Cameroon is here with me today. I'm going to let him introduce himself. Thank you, thank you, thank you, my brother, for coming on. I really appreciate, and thank you for reaching out. So please greet our viewers before we continue with our discussion. Welcome.
Hi, viewers, everybody. I'm happy to be here in this platform. Gladys really made an effort to bring me in. But let me start by introducing myself. I'm Dr. Gwewasang Martin. I'm a retired family health doctor and in private practice, a sexual and reproductive health expert, now venturing into entrepreneurship and higher education promotion. I am also a member of the Maternal Health Task Force, Women and Health Initiative, Harvard School of Public Health, and the University of Oxford Maternal and Perinatal Health Institute. I am also a certified social change advocate and ambassador of the Global Giving School and in pursuit of the UN Sustainable Development Goals. That's Dr. Gwewasang.
Wow, 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 wow. That's a long introduction, but a beautiful one, and we need it. And where I'm allowing you to go that far, I'm happy because we have the expertise in the house, in the continent of Africa. And what a blessing that you are on the ground. Thank you for reaching out, Dr. Wegasang. So one of my recent videos that I've been doing about health, and I had made an open invite to anyone who is in healthcare. As long as you have the credentials, you can speak from the point of authority where you are certified from. I welcomed you, and still the floor is open, and he reached out, and here we are. I'm so blessed to have you here because number one, not only for your expertise, but because of the desire that you have, to do something with your expertise, especially in social change. We know there are so many challenges around the world, especially in developing countries. And to be more specific, today we are talking about the continent of Africa and the issues and the challenges that we have in healthcare. And maternal health is one of the areas that really is limited in resources, or if the resources are available, in short, the healthcare infrastructure is strained, to say the least, in the continent of Africa, many countries. And I believe that Cameroon is no much different from Kenya or from South Africa or from Ghana, from Nigeria, from the many countries of Africa, from Malawi. And when we have people on the ground like you, people who have worked, you are a retired family physician, but and you still have that desire and the passion to continue doing something in the community. And so I'm going to welcome you now to give us an overview. I know your career is very rich. You have worked many years, but I want you to give us an overview, more detail of who you are in the healthcare industry. Feel free.
Yeah, like as I said, I'm a family health clinician. I worked for 25 years before going on retirement, but I have the passion to keep on sharing my knowledge, the little I know in healthcare. I'm also a freelance lecturer into so many universities in Cameroon. So I'm not limited to anywhere. The Ministry of Education authorized me to go to schools and organize reproductive health talks with children. And I've been doing that for 60 schools, touching a
Wow.
population of 160,000 people, school students.
Wow.
Then while in the community, I keep on touching my people because I know that health is worth. Health is worth. Everybody needs to be healthy so as to be worthy. So that's me.
Awesome. And I love the fact that, in as much as you are educated, you have worked, you have retired, you continue to impact the society, that you are focusing also on the young generation. Because as we know that the young generation, the young people are the leaders of tomorrow. And tomorrow is not far, it's here. And what a beautiful thing for you to empower them, for you to share the knowledge that you have with them. Because as you become more wiser, as your years go by, you know that you need people who are going to carry the baton and keep the mission going. And touching community also. We see how many challenges are in various communities in terms of accessing healthcare, in terms of affording healthcare. And, the list goes on and on. Now, during your career as a family physician, what are the major issues that you saw in healthcare that you wished that if you had a way to change them, you could change them? What are the three main challenges that you saw?
Thank you very much. As far as my career and work is concerned, I saw three main things, but they are not the only things that I saw. I saw more than that. But
You
since
can
you have
say you
limited,
can say more. So the list is three, but you can go as long as you want.
I was just saying that since you've limited me to three, I want to end in three.
It's
Because
your day,
I've
so
seen,
feel free. Uh-huh.
yeah, I think that one of those challenges I saw is aging population.
Okay.
The aging population of Africa or developing countries is training healthcare resources and require adaptability in healthcare delivery. That is the
Oh,
major challenge
okay.
which I saw. One of the other challenge is chronic disease. Africa is prone with so many things. The 54 countries in Africa, if you are a European and you want to come to Africa, you read the history of Africa, you think that all the diseases are in Africa. And that if you step your leg there, you just quench, you die. But Europeans are living in Africa and especially in Cameroon. They have the ambassadors of America, ambassadors of China, ambassadors of all over. They are there living with us. They are not yet dead. But this chronic diseases management, we have a rising prevalent disease such as diabetes and cancers. We have also cardiovascular disease, which needs to be addressed. But we need to have access to affordable health services so as to better address them. So we have healthcare providers that are poorly trained. We don't have good training, poorly trained. And once they are poorly trained, the result is poorly handled, poorly delivered. Yes.
Okay. So
So
you
there's
have
that.
said, okay, you have said three, so, or inadequate training, so to say. But starting from the
Yes.
aging population, with the challenges that you have seen with them, and these diseases that, the lifestyle diseases, but with the aging population, what do you think uh, exactly, what's the issue that you have seen with the aging population in terms of their health? Is it that they don't have access to good health, or what exactly, and what can be done to mitigate or to kind of alleviate that problem or solve it, to say?
We need to have a healthcare plan for the aging people. They need a healthcare plan because I, for one, I'm 63. If I'm still there, it is God's help, not because I have a health care plan for myself. No. When we are getting older without a good health care plan, it is likely that a disease can come up and we can quickly die. Take, for instance, if you don't have a health care plan at the old age, I mean, you cannot treat cancer, you cannot treat cardiovascular diseases that come up with you. You can't do it. It's so costly. There is no affordable healthcare services within our system because we first of all work in limited population and limited resources, limited funds. And so it is difficult to go through your working life and also safe to take care of yourself at the old age. I, for one, I can take an example, a scenario like me. I was taken by stroke. I was hit by stroke.
Oh.
Me talking with you now. Yes, I just came out from the hospital. 3 months ago, I was in the hospital because of stroke. And my right hand side was paralyzed.
Oh.
But because of assistance from friends and colleagues, they contributed the funds that I have to use to get myself back on the rail. If not, that would have been all about me. And I wouldn't have been here sharing this knowledge with you.
Whoa. First of all, I thank God for preserving your life. It's important. You know, God knew, I believe, that you needed to be somewhere, you needed to be here today to share your experience and to share your knowledge. And I see the importance of having a healthcare plan for the aging population because I can give an example of my mom. She has been healthy for the most part of her life until, you know, recently when we needed her to go to the hospital. She needed to go to the hospital. And by then, you know, she did not have a private insurance. If you know, I don't know about Cameroon, but in Kenya, we have something called NHIF. NHIF is for people who work, they have a certain kind. And for people who don't work, like my mom, they have a certain kind that really pays very little. So we had to get her that kind of insurance. But with the aging population, as we know, you know, we pray for good health and everybody will want to live a healthy life. But there are lifestyle conditions that come as we age, things like the blood pressure because of the change in the anatomy and the physiology of the blood vessels. You find maybe the blood pressure has started going up easier than usual. You eat a little bit of salt, you find your blood pressure has gone way up. And many people don't feel the need to go to the hospital until they are very sick or until they have actual symptoms. So what you are saying is having a healthcare plan for the aging population that actually focuses on preventive health before a problem comes. It's very, very, very important. And I think as people who are trying to work towards, you know, improving our society or contributing to our society, I think is something that we need to focus on and that I will encourage our governments also to consider, because this aging population does not work. Imagine for you, you have said friends came together to pool resources for you to receive treatment, for the stroke to be back to where you are. Can you imagine of an elderly person or someone who had the same issue as you, but did not have help from the community, did not have friends who could be able to pull resources? Because I believe you, being a physician from the previous, you have a certain group of friends, at least the people who could be able to pull resources to help you through. So it's very, very important. I really see the need because you are a practical example. Now we go to chronic diseases. You said the major ones is diabetes, cancer.
The major one, diabetes, cancer, cardiovascular programs.
I'm gonna go with the First of all, because it's becoming alarming. I know we're going to talk about diabetes and cardiovascular diseases, but why is cancer rising so fast in Africa?
That is the question in mind. Even us here in Cameroon, we are asking that question. Unlike before, in our days, there were no cancers. Why is it prevalent so much now? We keep on asking that question and we can't get a good answer or somebody to really give us what is happening these days. But we want to kind of say it is the evolution of time. Time goes with those changes, and we are not surprised to have cancers that are now prevalent, and most especially among us Africans. It's not because we have caused a problem, a particular problem, that we are punished with cancers. No, it's not. It's just evolution with time. So I think that is and I want to also think that drugs, most of these drugs these days, causing cancer and all of those things, is some of the causes because we take drugs, we don't know the real source and the molecules and how these drugs are produced. So we just drink them, and we drink the drugs, and they can cause several cancers in us without us knowing. And some of our eating habits is also a cause. People drink a lot of alcohol, people smoke a lot of cigarettes, and you're bound to have these cancers. You can have cancer of the throat, cancer of the mouth, cancer of the nose because of cigarette. So I want to think that these are some of the causes. So some of the causes of this cancer is caused by us following our eating habits and the type of food that we eat. So I think that is the only way I can think that is how we are getting these cancers, not because we have caused a problem with.
Yeah, just to be specific, these are theories, that have been raised, the possible causes or the suspected causes of cancer. And they are not general. Not everyone who has had cancer did one of the things that, these are just some of the causes that are, or the predisposing factors to causing diseases like cancer. Or as you said, diet. I think I've seen a lot of theories flown around about diet, the foods that we eat, the air that we breathe, a lot of pollution going on. Because I remember when I was growing up, I do not remember, somebody being buried because they died of cancer or they were sick of cancer. Then as we grew up going to high school, I remember maybe one person in my lifetime of high school. Then until recent years, it's like left, right, and center. Someone is being diagnosed with cancer. And the reasons that have been given are like predisposing factors. Even stress, if it takes so much toll on you, and if there's one other or two other factors of what the doctor has listed here, you are more predisposed or more likely to become sick than somebody who is maybe eating healthy, someone who has no history of family member having died from cancer or having suffered from cancer. That's why when you go to the doctor, usually they will ask, is there anybody in your family who has, suffered or died from cancer before? So there are so many reasons. There's no one reason, and that's one area that I would really like to see more resources mobilized to do more research towards getting the cure for cancer, because it's robbing families of loved ones. It's leaving children, orphans at a very young age. It's leaving couples widowed too early. I can't tell you how many people I've had who have, gone to rest or who have lost their life in their 40s. This was never a common thing before, you know. So these are some of the things that I would really like to look more into details to see, and I would love to see our young people who are growing up now, the children you are empowering, the schools that you are going to. Continue talking to them, encourage them to be proactive in participating in this kind of research, doing research about such conditions that are robbing families of their loved ones at a very young age. So we come to diabetes now. What has been your trend also in diabetes as a physician, as you are practicing and as you have retired, and what are the main challenges that you saw patients with diabetes have?
Yeah, those who develop cancer, as I witnessed this, they find it very difficult to treat the cancers, first and foremost, because the cost is really enormous, it's high. Cost of treating cancer here is high. So, and as far as cancer is concerned, I work with the Hesperian publisher in US, Hesperian publisher in US, and I made a research on cancer in the field because I field tested in the field cancer programs and made a research and wrote a report and sent to them. So and they use that report to produce this book that is widely read, Where There Is No Doctor. If you look at the edition of 2015, you will see my name in the appreciation page because I research on cancer with the funds that they provided for me. So I've done a motion.
Congratulations. I'm proud of you. Thank you. I would have to read it. Where there's no doctor, right?
Yeah, Where There Is No Doctor. The edition
Awesome.
of 2015. You will see me there. I did a lot of work for them. And so I'm also proud for myself.
Yes. Yes.
So the one thing we notice with the cancer program, as I said, is cost. The cost and then the medication. To easily get the medication is not easy. And then to be able to guide the people who have not gotten cancer to live healthy, it's also a major problem because they just eat anyhow, eat anywhere, eat anytime. They go to their ceremonies and eat around 3 o'clock, 4 o'clock in the night. But whereas food has to be eaten latest 6 p.m. and you now follow up with fruits to be able to take good care of yourself.
Awesome. We need to continue this conversation. This is awesome. I'm very proud of you. I have to repeat saying that, and I'm going to make an effort to read that book. But let's go about the cost of treating cancer. It's enormous. It's expensive. And imagine if you don't have insurance or if you don't have a health plan to pay for that care. It's painful. That's why I say there are things that we should not be talking about in 2024. They should be human rights, to live a healthy life, to be able to eat healthy, to have access to food, access to health care. And if, people become sick, and by the time they have the ability or they are taken for screening, is too late because they did not have, a way to pay for that service. They did not have a way to have that treatment and then go to the treatment itself. It's rough. If you have had loved ones and seen when they are getting chemo, when they are getting radiation, it's a rough treatment. But it's necessary, but rough treatment. And that can be a debate of another day. People have different opinions about these treatments, but that's not why we are here today. Today, we are here to express the challenges that we are experiencing, and especially Dr. Gwewasang, who is in Cameroon, who has worked for all these years and who is sharing his knowledge. And as you see, diabetes also with go now to blood pressure. Blood pressure. You see, he said he had a stroke recently. And we know there's a correlation also between the blood pressure and the stroke also. So what can you say about the blood pressure? What's your experience that you have seen, and what could you say about it?
Yeah, as far as blood pressure is concerned, majority of the most of the things that lead people to have high blood pressure is stress. When you are thinking about this and that, thinking about where to get food, where to get money, where to get social interactions, and you keep on thinking when people are sleeping in the night, you are thinking. That's what causes most of these situations. And shocks that most people get into. You can have a problem which you don't have a way to solve it.
Mm-hmm.
And that situation can also lead you to high blood pressure. It's very likely. Now, you can have a patient who is in the hospital, you want to help, but you cannot, you don't have the money to help.
Mm-hmm.
You are always thinking and thinking and thinking. So that can lead now to your high blood pressure. And like as I said, stress is really one of those things. You need to work, you need to rest in time, stop alcohol because people take a lot of alcohol and it creates a lot of problems in their system. So if we can reduce our rate of alcohol, reduce our rate of stress, we're stressed. If you don't have a way to help somebody, but you have the willingness, there is nothing you can do.
Mm-hmm.
You except you want to steal, because if you don't have, you don't have.
True. Wow. You know, those are good tips. And actually, that's where I was heading. I was like, now we have talked about this, and you have had stress is a big, big, big factor in having you predisposed to these conditions or having me predisposed. So, as the doctor said, is what can we do with these situations? You know, yes, you are stressed. Yes, people are asking for help from you, but you are not able to help, or you help where you can. You cannot be able, you know, there's nowhere you can go. You are not going to steal to help them. So how do we deal with this? You know, we have to find ways of trying not to get too much into it, because then we end up being stressed. Our blood pressure was high. We have had people who have lost life because they became so stressed, they ended up becoming depressed. And as you know, blood pressure is the heart is a very delicate organ, you know, very, very important. So he has said we have to take care of our blood pressure. If you have access, my contribution will be if you have access to these free clinics. Sometimes they, you know, you hear they happen in community, and there's a blood pressure check. I was talking to my sister a few months ago. I was just concerned because we had a loved one who was unwell, and I knew she was taking care of her day and night. And you know, the hospitals back home, some hospitals don't allow you to sleep on the bed where the patient is. So at night, you are literally sitting with your feet down the entire night. So I was concerned about her feet. Are your feet swollen? Have you had your blood pressure checked? So, and then she mentioned that in their church, sometimes they have a session where someone comes and checks, you know, the nurses from the community, they come and give a free clinic of checking blood pressure once a while. If you don't have a blood pressure machine, I ask you to try to find out if there is anything like that in whichever part of the world you are in. Have your blood pressure checked. Dr. Gwewasang, you'll be more useful here. How can you advise
It is.
people to monitor their blood pressure? I think you froze. Can you hear me? I think your network. When you
Yes,
start,
it's not too
okay, try to speak.
disturbing. The network is now disturbing.
I can hear you.
Yeah, but you hear me and you don't hear me because the network is getting bad now.
I hear you.
Okay, continue.
I was asking you, how can you advise our people to monitor their blood pressure? Do you sometimes have like a free clinic, or how can they keep up with knowing their blood pressure even if it's once a month?
No. We don't have free clinics. That's one of the things. High cost of living is the disparity, addressing inequality and access to healthcare services. We don't have free clinics. You must be able to have money to pay for your check, which is 1,000 francs. And there are families that don't have the 1,000 francs, and so they can hardly go to check for BP. They can hardly check. Because he will be having that 1,000 francs. He wants to eat. He will not want to go and spend because he wants to know the state of himself.
Wow. And now I'm wondering.
Which is the BP, which is not normal. He will stress up. He will definitely stress up. So it's better he stays until the worst comes, until he's very sick, and then gets to the hospital before they can diagnose that. You cannot find people moved into health facilities to check for their health situation. No, never. And there are no free clinics, no free services where people can go. No campaigns for that.
But I have a question. Are those campaigns allowed? Say, for example, if you had a way, you, Dr. Gwewasang, you had friends come together, get you 5 blood pressure machines, get you a machine or 2 machines for checking the blood sugar, finger sticks for the patients. Are those campaigns allowed in your country, in Cameroon?
They are allowed, and I've done many, but with my own resources.
Okay. Okay, that's awesome. That's a conversation that we can continue having.
Because you need to obtain an authorization.
Your network has become
to be there to witness, which you have to pay them. You need to pay them.
Wow. You pay for the campaign?
Which is again a different problem. Yes, you pay for. The administration signs the authorization, and then you organize the campaign. And the materials for the campaign, you must afford. You must provide it yourself, which is so cumbersome. But if you have the means to do the resources, to get the items and to do the campaign, a man like me, they will sign it.
Okay. I mean, at least that's good news to hear that
administration,
the campaign...
and then spend money to obtain the material myself.
Okay.
Which at this age, I can't do it again because I'm retired.
Yes, but you have friends, you have people you can bring together to mobilize a few resources. It might not be a bigger scale, but I think it's a good thing. It can be done.
No, if I have the resources, I can do it. It's easy.
You're still young. you retired early.
Okay, thank you.
Thank you so much. Our viewers, we apologize. The network was a bit bad, but what he was saying, I was asking if they have those free clinics, and I think that's a challenge that I'll give to the... But you said you don't have those clinics.
We don't have those free clinics.
But the campaigns are allowed.
The campaigns are allowed, but you have to spend.
Okay. At least the campaigns are allowed, and I think that's a challenge. We have very good affiliates, I'm sure, who will love to be part of that, uplifting humanity.
Okay.
We have many Cameroonian affiliates who are really passionate about uplifting humanity. We have many Africans. We have, we have MFA. We are Africans, and it's our continent. We are proud of the African continent. That's home, and I think we can do a lot. We have the opportunity to do that. We can do it together as one family. We are one big, one passive family, and I'm blessed to have you here. So thank you so much. Are you able to give any closing remarks? We leave it at that, and then we'll have our next episode next time.
Okay. Thank you very much.
Can you hear me?
Thank you very much. It was nice. Yes, it was nice talking to you. Thank you very much. And God bless you.
Thank you so much, Dr. Gwewasang. It was a blessing having you here. This is just the beginning of the conversation, and I think we will continue. We have more topics to discuss. And thank you for volunteering. We love to hear more. And I think regarding the campaigns, it's very, very necessary, especially for those families who are not able to access or to have access to just have their blood pressure checked, even if it's once a month, at least to know your baseline, so that you are giving the free education, preventive care. It's very, very important. There are things that we can do without spending, especially sharing the knowledge, and you are doing it. So I thank God for you, and I can't wait for our next session. Our sister from Kenya, she's still on the road. She will be with us next episode. I could have loved to hear from both sides the differences, but we are one continent, one family. Thank you. God bless you.
Yeah, thank you very much. Thank you very much.
I appreciate you so much. And congratulations for that book. I promise you're going to text me the details on how to have access to it, and I will read it.
Yes, I will send it to Hesperian Publisher.
Awesome. Thank you. God bless you.
Thank you too. And
thank you,
too.
our viewers. Bye-bye. And if you had us talking over one another, it's the network. By the time I hear him, I'm already speaking. But we hope all these things will become better with the time. Thank you for your patience.
Thanks very much.